the contextual needs. Professor Devet Swanepoel, who is from the WH Collaborating Centre for Prevention of Deafness and Hearing Loss at the University of Pretoria, will now brief us on the current situation in the South African context. Thank you, Devet.
Hi, everyone. Good morning. It is a very exciting day to see this World Report on Hearing launched in South Africa. Thank you to all the stakeholders from government, the World Health Organization, the South African World Hearing Forum members, and the various other organizations, including the Clinton Health Access Initiative, who are also hosting this webinar today. Our department at the University of Pretoria is very proud to be an official World Health Organization collaborating center for the prevention of deafness and hearing loss in South Africa, but also across the continent. And I will be sharing some thoughts on the World Report on Hearing, this very important document that was released and that you've heard quite a bit about already, but within the South African context in particular. So I thought I should start off just by recognizing again, as was mentioned earlier, that South Africa has a track record of supporting hearing on the global front. In the build up to the release of this World Report, South Africa served on the executive committee of the World Health Assembly. And from our department and other stakeholders, we were in regular contact with the then Director General of Health, Ms. Precious Matsotso, to request that her office kindly support the cause of persons with hearing loss. The first letter was sent in 2014 already, requesting that South Africa support the motion at the World Health Organization's General Assembly for a progress report on the status of disabling hearing loss globally. And at that stage, the Director General started this process of support for ear and hearing care as a global priority. And in 2015, South Africa also supported a motion to have a resolution on hearing loss at the 2016 World Health Assembly. And in 2016, South Africa further supported the motion for this new resolution at the World Health Assembly. So South Africa has supported this process at all these instances, and finally we saw the World Health Assembly resolution published in 2017, calling amongst other global actions for the development of this World Report of Hearing that has just now been launched. And as South Africans, we certainly look forward to see this track record of support continue as the World Report on Hearing recommendations are implemented and included also within the South African healthcare system. So how common is hearing loss in South Africa? We've heard some global figures, but the prevalence of all severities of hearing loss per 100,000 people, if you look at the map to your right of Africa, indicates that South Africa's prevalence is higher than most other countries in Africa. There is an estimated 12.1 million South Africans who have some form of hearing loss, which constitutes 20% of the population. 3.6 million have a moderate or greater hearing loss, which constitutes about 6.2% of the population. And this latter group are the ones that should be targeted primarily for treatment. Africa also has the greatest expected percentage increase in persons with hearing loss who need treatment, from 39 million at present to 98 million by 2050. So South Africa is going to see a rapid increase in the rate of hearing loss. So what does this prevalence of hearing loss translate to in terms of the health burden? Well, African countries have the highest burden of hearing loss according to the years lived with disability metric. And this is mostly due to poor access and quality of care. On the right-hand side is a figure illustrating the healthcare access and quality index against the years lived with disability index. And what you can see is that the African region, represented here in pink, clearly has the highest burden and the poorest access and quality on the health access quality index. So it's not surprising that the annual cost of unaddressed hearing loss on the African continent is estimated to be a staggering $27.1 billion. South Africa also has limited ear and hearing care resources and access to treatments for persons with hearing loss. 56% of African countries have less than one ENT, ear, nose, and throat surgeon per million persons. In South Africa, this number is higher at 4.6 ENTs per million people, but it's still severely inadequate for the needs of the population. 78% of African countries have less than one audiologist per million people. South Africa has 8.3 audiologists per million people, but this ratio is still totally insufficient to attend to the needs of the 3.6 million South Africans that require services. Unsurprisingly, hearing aid coverage, if you look at the figure to the right, the map of Africa, hearing aid coverage for hearing loss in South Africa is only between 6 to 10% of people with hearing loss. This means that more than 90% of persons with hearing loss are not receiving treatments or the treatments that they require. So South Africa faces challenges. On one hand is the steadily growing number of people in need of ear and hearing care, driven by demographic shifts. On the other hand, the health systems do not have the capacity oftentimes to provide ear and hearing care services, mainly due to a lack of human resources, lack of policies, finances, devices, and equipment. In addition, at the level of community and among policymakers and even healthcare professionals, there is a persistent lack of awareness about hearing loss. And these problems are further magnified by the stigma lined with ear and hearing problems. That is a key challenge we need to address in South Africa. The good news is that the challenges can be addressed, and as the World Report on Hearing shows, through numerous examples, are being addressed through innovative and evidence-based strategies. So what is the way forward in South Africa? The World Report on Hearing outlines the vision of integrated, people-centered ear and hearing care, which requires the integration of prioritized ear and hearing care interventions delivered through a strengthened health system. The World Report on Hearing proposes a package of evidence-based interventions, acronymized as HEARING, Package of Interventions. You can see those listed to the right, and you heard them mentioned earlier already. So South Africa should determine which interventions best suit our needs by conducting an evidence-based consultative prioritization exercise. Ensuring access to the prioritized interventions and services requires actions at all levels of the health system. This includes policy development, building human resource capacity through education and training, task sharing, standardized guidance and practices for procuring health technologies, ensuring financial and social protection, as well as setting targets and indicators for ear and hearing care. So here's an example of the first mentioned intervention listed in this World Report on Hearing. And it entails hearing screening and intervention, which we've already heard a number of comments on. So the objective here is to ensure timely detection and intervention for hearing loss in those most at risk. And this is intended to occur across the entire life course. Considering the South African context, if we just think of newborns and infants and preschool and school-aged children, we know from available research evidence that less than 10% of these children and infants will have the opportunity for hearing screening. In school children, this is despite the integrated school health policy that requires all children in grade 1 and at subsequent intervals to have their hearing screened. So it's clear that there's a gap between the required services and what is currently happening. And the World Report on Hearing highlights some strategies and innovative approaches that can address this gap if we use this first intervention as an example. So, two strategies highlighted in the World Report on Hearing to improve early detection of hearing loss through screening is the use of task shifting and employing innovative technologies and telemedicine. Task shifting, as seen on this page from the World Report on Hearing, entails training health workers like community health workers or lay health workers to conduct services like screening and perhaps even some assessments, as you can see highlighted on this page from the World Report on Hearing. This can enable decentralized, community-based human resources that can then deliver services that are currently not reaching the population. The task shifting approach for hearing screening is also enabled by new and innovative technologies that are mobile, that are automated, that includes quality control measures and cloud data management for remote surveillance. And as illustrated on the second page, is a community health worker in South Africa using a validated smartphone hearing test to screen for hearing loss in one of our community projects. So the research that we've been conducting at the University of Pretoria with various collaborators have produced and published evidence showing that using validated mHealth screening technologies allows community health workers to accurately assess hearing on par with healthcare professionals and in communities as well. The research shows that there's no difference between screening outcomes for school health nurses compared to trained lay health workers in these models. These technologies also enable combined hearing and vision screening on the same device used by community health workers, with screening programs, outcomes within prescribed performance indicators. So this leverages the same technology and the same person to screen multimodalities, the sense of hearing and vision. So screening programs facilitated by community health workers using mHealth technologies can enable low-cost, scalable models of early detection. And in two studies, the full cost models for delivering hearing and vision screening to children in low-income communities was between $5 and $6 per child. So in conclusion, hearing across the life course is possible, according to the World Report on Hearing, through the prevention of hearing loss, through the early identification and detection of hearing loss, and thirdly, through timely and appropriate rehabilitation services. South Africa has limited resources. Existing models of ear and hearing care are centralized, they're insufficient, and they're largely ineffective. But challenges can be overcome with people-centered ear and hearing care that is integrated into existing health systems, and by following many of the helpful practical recommendations by the World Report on Hearing. And decentralized models that are supported by task shifting and innovative technologies is just one way in which we can make hearing healthcare more accessible. So to end off, in the words of the World Report on Hearing, the cost of doing nothing is one that South Africa cannot afford. Thank you very much for the time and the opportunity to share with you.
Thanks, David, and thank you too for highlighting the South African context, the needs, as well as the multiple burden of disease, while offering opportunities and innovations for an integrated and person-centered care approach to address the